So good evening, everyone. Can you all hear me?
Good evening. Yes, I can hear. It seems I'm like the only person here.
No, you're not the only one. You're up to eight. Can you all see me?
No, we can't.
Okay, just give me a second. Trying to say it. So. No, you're not. Hello. Can you hear me now?
We can hear.
All
Yes, we
right.
can
Thank
hear you.
you. Okay. So good evening, everyone. Welcome to another live session with AMGS. So today we're going to focus on nursing interview, and I've asked a lot of you on the group to drop your nursing role when you're having your interview, and also to drop which role you're having the interview, the date, and which hospital. So I can see that most of you are having interview for the UK and probably some NHS departments. So welcome. And I don't know if has any of you had any session with us before, because we usually hold this at least once a month to support people. Um and we do a free session every month, once in a month, and then we also have sessions that we have with our different team in AMGS. We support you with your interview, one-to-one session, and all of that. If you need help in prepping for your interview, so have any of you joined our free session before? Hello, are we all here? Has any of you joined our free session of interview preparation before? If you have, say yes. If you have not, say no.
No, I have not.
Okay, all right. Thank you so much. Thank you. Thank you. All right. So today's interview is going to be an interactive section. I really want everyone to, sorry about that. I really want everyone to speak. I really want everyone to contribute, because the thing about interview is that if you are not speaking, if you are not saying something, then actually there's no much point, because in an interview, when you have your interviewers and the panel who are looking at you, asking you questions, they're expecting you to speak out. So there's nothing like, oh, I'm shy, I cannot talk, and all of that. No, because in an interview, you're going to be face to face. They are reading you, they're reading your both verbal communication and your non-verbal communication. Remember, your non-verbal communication also shows how confident you are, shows how truthful what you are saying is. If you are speaking and it looks as if you have crammed, they can also read it from your expression, right? If you are shy and you are saying, I'm confident, I'm that, that's actually something that is she really confident like she says she is? So the only way you can be able to do very well in your interview is by speaking out and talking, right? And don't think that you just keep it in your mind. Okay, it's in my mind. On the day of the interview, I'll be able to say something. Actually, it doesn't work that way, because on the day of the interview, right? You want to make sure that you are very confident and you've practiced, because it's only when you have practiced a lot you can be able to say something. You are prepared. You've not crammed. You are prepared to answer any question. So I have a way I want to do today. Today is going to be different from the way we used to do every other interviews. Today is going to be different, okay? And so I'm just going to pick a random person and just ask you a straight up question, and let's see how you're able to answer it, because I believe that you already understand the main, especially you guys. I noticed that most of your interview is like happening in the nearest weeks or so. So I'm sure the do's and don'ts you must have read, you must have prepped, you must have known, okay, how to look for an interview, how to look fit, how to look good, how to make sure that your background is quiet, make sure that your Wi-Fi is working, make sure that you have practice with your phone. If they say you're using Teams or you're using Microsoft, you're using Zoom to hold the interview, I believe that you must have at least practiced how to use Zoom, especially if you're someone that is not tech savvy. You must have practiced. Oh, do I know how to utilize this app very well? What hitches? Have you also practiced with your friends, your family member, and see, okay, how good am I in terms of communication? Have you also looked video yourself in the camera and look at yourself and say, oh, how am I talking? You don't need to form funny, just be natural. You understand? And make sure that your background is quiet and all of that, and also be confident. So I believe all those preambles, we already know what it is to get ready. Okay, so I'm just going to go straight so that won't take too much time. So you can see Justina here. Can you unmute your mic if you can hear me, Justina?
Yes, I can hear you.
All right. So your first question, you have just walked into your interview. You have sat down. Can you introduce yourself in 30 seconds?
Okay. Can I start now?
Yeah, carry on.
Thank you so much for the opportunity. Okay, my name is Justina Chizroke Agoha. I'm a registered nurse with over 4 years experience. I have a diploma in nursing from School of Nursing Umulo 2021. Over the years of practice, I have developed core nursing skills such as assessment, planning, implementation, and evaluation of care. In my day-to-day practice, I make use of clinical skills such as monitoring of vitals, documentation, cannulation, venipuncture, catheterization. Um, catheterization. I'm committed to continuous learning. I ensure patients' safety and infection control, and I make sure that I work within the NMC guidelines for nurses. Mm. Is it not more than 30 seconds?
Okay, because I said 30 seconds, right? Okay, that's fine. So in 2 minutes, let's give you time because usually you have like 2 minutes. In 2 minutes, introduce yourself. Just take your time. Don't rush.
Okay. All right. Thank you very much for this opportunity. My name is Justina Chizroke Agoha. I'm a registered nurse with over 4 years of experience, and I have a diploma in nursing for School of Nursing Umulo, and also have my NMC. I have my NMCP. Um, in
Yes.
NMCP in actually sorry, in my over years of working, I have experience in in-person and community health care through in my years of working. And one of my core nursing um, skills is the nursing process, which entails assessment, planning, implementation, and evaluation of care. And also, I also make use of other clinical skills such as cannulation and venipuncture, I documentation, catheterization, and also I ensure to adhere to protocols and infection control protocols to ensure that I carry out patient safety, and I'm committed to continuous professional development and learning, and I make sure that I work within the NMC guidelines for nurses. I'm particularly interested in this in-person and community role because as someone who in the course of my work in Jajo Clinic, I have experience in community healthcare management, community nursing, and I am committed to providing holistic care to people who can not access it easily, and people who are living in isolated and secluded areas. So, secluded areas, I liaise frequently with the GPs, the community health nurses, and other members of the multidisciplinary team to provide care, and also make use of telemedicine and remote consultation so that my patients can access specialist care. I believe with my clinical skills and I believe with my clinical skills, my good sense of judgment, and my ability to be adaptable and flexible, that I'm a good fit for this role. Thank you.
Okay, thank you very much. Now take a deep breath. You've done well. Well done. Okay. So what do you think you did good and what do you think you need to work on?
I think I tried to cut as much as as much as the specific person specification requires, but at the same time it feels like kind of I was cramming and I was like kind of unsure the pauses, the repetitions, like it felt like I was kind of jittery and not that confident. Yeah.
Okay. So what did you do good though? Because you need to also look at your good side.
The good side was trying to like talk about the important things they need, like starting from my background, the clinical skills I have, and also why I want to be part of the team and what I'll be bringing to the team. So I think that's the good part.
Okay, that's fine. So I have Miss Jane. So do you agree with her? What do you think she should improve on? What do you think?
Okay. I think she should calm down. She should calm down. She's a bit nervous.
Your network is
That's
not very good. Your network is
what
not
I
very good.
observe, that she should calm down. Okay.
Miss Jane, just try and leave and join again. Your network was really shaking. Let's have another person answer the question. So I have Adeleke here. Are you there? If you are there, please unmute your mic. You're the only person here, Adeleke. Are you there? Okay, if you're not there, can I have, and remember this session, everyone must be interactive. If not, then I mean, there's no point of us being here, right? So I have for Lauren Show. Are you there? If you're here, please unmute your mic and speak. I don't want to call your son name now. When it's space. If you are there, follow me, sure B. Please, can you unmute your mic and speak? Okay. All right. I have Jennifer. Are you there? Jennifer. If you're not muting your mic, I'll remove you from the space because that means that you don't want to be here and there's no point of being here. So I have Jennifer. Are you here? If you're here, unmute your mic and speak.
Yes, I'm here.
All right. Thank you so much. So
Okay.
we had Miss Justina just speak now.
Mm.
I want you to evaluate her. Tell me what she did good and what she needs to improve on.
Well, I listened through and I think she did well because she touched on all the necessary areas in her person specification for the role. However, she was nervous. Yeah, she was nervous, but that's just the only thing I think she didn't do well on. Thank you.
Okay. All right. Thank you so much. Thank you so much for that. So, Miss Justina, you did well, right? You tried to cover so many parts, but just like you said, it felt I could also feel like you probably had crammed. And I also felt like Miss Jennifer just mentioned you were nervous, right? Probably because I just hit on you. But then that's what happens when you go to an interview. The moment you sit down, that's the first question you are thrown at times. Not probably not at time, not all the time you might get that question, but sometimes that might be the first or second or third question you thrown. And you have no room to be like, okay, I was nervous, that's why. You have to comport yourself and give an answer. And just like we all say in most of the interview session we hold, always have a structure. Please, for something to work in terms of anything in life needs that wants to work well, you just need a structure for it to work. You do not need to cram, you do not need to what are they calling it to write everything in paper and say, oh, this is what I'm going to say word for word. Nothing like that. All you need to do is, okay, I will introduce myself, probably my school. After then, I'll introduce my career, what I do, and my previous place of work, right? After that, I will introduce my skills. After my skills, I will introduce what I'm bringing to the organization. I can lastly end it with my professional development, if I've done any training, you understand, and all of that to improve myself. I'll add it, and also if I've got any award or qualification. Just those 5 steps will enable you cover a lot and enable you talk about yourself in ease. Do you understand? So you don't need to cram. All you need to do is to understand these 5 different steps. Introducing yourself, maybe your school, your degree of what you had, right? Then next, your work and your previous place of experience. You can add that, like your work history, right? Where you've worked, the area you've covered, or where you're working currently, and make sure that when you're mentioning this is relatable to the role you are applying for. You understand? For example, now you have to read in between the line. If you are applying for a theater role and you've worked in a surgical ward or a medical ward, even if you are mentioning I'm working in a medical surgical ward, you should lay emphasis on obviously pre-operative. So when we've taken care of patients pre-operatively, post-operatively, and your previous place of experience, you understand all those sort of things. Then you talk about your skills, what you've got, right? And how you've taken care of some. You don't need to go into details because it's not here we are doing the smart or the star technique. No, you can just do an evaluation on how a patient. Oh, yeah, I'm so confident. Oh, my patients have commended me on so many occasions on how they're happy, how I went an extra mile for them. You understand? So all those sort of things. Just you don't need to go in depth. How I went an extra mile for them. So that's the that I'm caring and I go an extra mile for my patients. I've also been one of the leading nurse in my team, so I've got leadership skill. So you don't need to go into depth, right? And then those are qualities you're trying to explain. Then next, you're talking about how you are using this skill to bring forward what you are bringing to their table and why they should take you. You understand? And then lastly, any professional developments you've had, any training you've had, don't disregard any training you've had. You can add it to summarize. So if you have these steps, you do not need to cram. That's all you need. And then you move ahead and that's done with that topic. So you've done well, but you just need to calm down and be a little bit more organized, okay? So thank you very much for that. So Miss Jennifer, could you just give me a second? In 2 minutes, right? So can you introduce yourself to us, please?
Yeah,
Okay, carry
thank
on.
you for the opportunity. My name is Jennifer Chidera Omeni. I'm a registered mental health nurse with an active NMC PIN. I'm also a qualified mental health nurse and general nurse educated to diploma level. I have over 5 years nursing experience across physical health and mental health settings. Currently, I work in the inpatient mental health unit where I support patients with a range of conditions such as schizophrenia, bipolar disorder, depression, and cognitive impairments, often alongside physical health challenges like diabetes and hypertension. In my role, I provide safe and effective patient care using the nursing process by carrying out holistic assessments, developing person centered care plans, implementing care, and evaluating care based on patient's progress in collaboration with the multidisciplinary team. I have strong experience in carrying out risk assessments using my using structured risk assessment tools and my clinical judgment to identify risks such as self-harm, suicide, deterioration, and aggression, and working with the multidisciplinary team to implement strategies to reduce the risks and improve patient safety. Through my experience, I've developed excellent communication skills, which I use to engage with patients, family or carer, and the multidisciplinary team effectively. I also focus on building therapeutic relationships with patients using a calm and non-judgmental approach to gain their trust, engage them in care, and support their recovery. I am confident working independently and as part of the team where I support with safe decision making and development and review of the person-centered care plan to support patients' recovery. I also have strong mentoring skills, which I use to support junior colleagues and students, thereby contributing to a positive learning environment. My organizational time management and prioritization skills enable me to manage high caseload of patients, prioritize my tasks based on clinical need and patient level of risk, and carry out my tasks effectively. I am responsible for my practice and I am responsible for my practice, act in line with the NMC code of prioritizing people, preserving safety, practicing effectively, and promoting professionalism and trust. Go, I'm having a class. Please, I'm so sorry.
No worries. Carry on.
Okay. Um, and then I'm also committed to continuous professional development, and I've taken courses on safeguarding, infection prevention and control, safe medication practice, and risk assessment and management, which enables me to improve the care I give to patients while prioritizing their safety. I'm interested on this role on viral ward, which is a medium secure forensic ward, because I'm passionate about supporting patients with mental health conditions and a history of offending, not just to stabilize, but to recover, develop coping strategies, and reintegrate safely into the community. My interest in forensic mental health nursing developed as a result of my clinical placement in the prison mental health setting, where I gained insights into working with this patient group within a secure and structured environment, and the importance of balancing care with safety. I'm also drawn to this role because of the values of NHS Tayside, particularly with respect and dignity, person-centered care, and multidisciplinary team work. In my practice, I am committed to treating patients with respect and dignity, involving them in their care to support engagement, and working with the multidisciplinary team to provide a holistic person-centered care. I believe my skills, values, and experience align well with this role. I am keen to further develop within forensic mental health and contribute positively to the team. Thank you.
All right. Thank you very much for that. That was detailed and insightful. Thank you very much. Let's have some. Oh no, let's have you evaluate yourself. So tell me, what do you think you did well, and what do you think you need to improve?
Well, I'm a bit nervous. That's one of the things I'm working on with this interview preparation. I was nervous, and I tried to cover my person specification, and I think I did well with that. So that's just it. Let other people tell me where to improve. Thank you.
All right. Thank you so much for that. So I have Mary Rose on the call. Are you here? Mary Rose, are you here?
Yes, I'm here.
Okay. Thank you so much. I was
Thank you.
about to say now that if you are not yes, you want me to kick you out, right?
No,
But it's
I just joined
fine.
now.
Oh, you just joined now. Did you hear the last person speak?
Towards the end.
Oh, so you didn't hear her when she started from the beginning.
Yes.
Did you hear her when she started from the beginning?
No, I wasn't here. I just heard towards the end.
Okay, okay, all right. So I have Osa Sunwe. Can we have that? Are you here? Please unmute your mic. Mary Rose, don't worry, you can mute your mic now. I want someone that been here from the beginning. Can we have Osa somewhere on mute?
Yeah, I'll unmute my mic.
All right, thank you so much. Um, I believe you heard her speak, right? Could you kindly evaluate her what she did well and areas she needs to improve?
Well, from what I heard, it was very, very detailed actually. So it got me thinking, was she reading from a book? I don't know, but it was very detailed and well put together. So I don't think there's any issue. I did not have any issue with it.
Okay, all right, that's fine. So, I want to say that she did well. Thank you so much, Sasori. I want to say that she did very well. She did try to cover most of the bases. And one thing I really, really, really want to appreciate was her calmness. She said she was scared. I didn't think she was scared. Was her calmness, right? She was calm. There was no rushing. She took her time to speak, right? It was like she knew what she was saying, and there's no need to rush because I'm here to get a job, right? So that was the vibe I got. But one thing that I noticed with the first person and her as well too is we try to cover all the person's specification. We do not need to do that. There's what they call the essential and the desirable. So you can pick 3 or 4 of the essential and that's it. You don't need to cover everything unless you feel like you've got time. Okay. But you don't necessarily need to cover because then it makes your work or your what you are saying too lengthy. Okay, so you don't need to cover every details there. You can cover 5 or 4 of it. If you feel like you've got time, maybe you are someone that speak fast like me, then and you feel like, oh, I've just spoken 30 seconds talk. And you feel like you see and you are reading the face of the interviewer, you don't think like they've gotten enough of you. You can add 2 more, but you do not necessarily need to talk so much about like list all of them. 5 or 4 is enough and that's it. Okay, but I want to say that she did well. At some point I did want to ask if she was reading from a book, but it was okay. All right, just fine. If you were not reading from a book, that's good. If you're reading from a book, try to learn not to read from book and just try to let it flow. You already have the structure, okay? So that structure is good enough. You just need to let it flow. All right. So thank you so much for that. Thank you so much. So
Thank
um
you. I was not reading for a book. Sorry, I wanted to say something. I was not reading from a book. I've been
okay.
practicing this. I've been practicing and practicing. So that's how we got this better.
Okay.
Thank you.
Thank you so much. So just like you heard, she's been practicing and practicing and practicing. And I believe now you've got this confidence, like, okay, so I can smash it now. So yeah, that's good. So I want to
Yeah.
ask the person that evaluates her, okay? Osasunwe, can you unmute your mic, please? I just want to be sure the person is here before I. Yes. So can you tell me what is safeguarding and who do we safeguard and in what situation do we safeguard?
Okay, thank you for the question. Safeguarding, it's should I say a protocol that has been put in place by um that has been put in place by
So you don't need to look for
UK
one big
officials.
explanation, no. I want what you understand as like personally what safeguarding means, who needs safeguarding and what situation do we safeguard. You don't need one big grammar or one full definition. What you understand in simple terms by that.
Okay, safeguarding is just a way of making sure a patient is not going through any form of neglect, um, violence, bullying. It's just a way of assessing a patient or whatever to be sure that the patient is okay, whether at home or with a carer. Now, and people that can be safeguarded are vulnerable adults like elderly patients, children also, and also adults that are having a disability, one disability or another. So those are people that are to be safeguarded.
Okay. Thank you so much. Thank you very much. Can we have Love Star unmute your mic? Thank you so much, Sasoi. Can we have Love Star unmute your mic?
Hello.
Hello.
Yeah.
Can you tell me a time when you had to safeguard somebody and what did you do?
All right. Thank you very much for that question. I can remember around August last year. I had a patient who was transferred to my ward. Then I observed that she was feeling uncomfortable around her husband. Therefore I understood that this might be a potential safeguarding issue. Therefore, I asked the husband in a calm and professional manner to give us some privacy, as I wanted to conduct an assessment on the patient. Then, while the husband was gone, um, I I asked the I asked open question from the patient, and the patient opened up to me that the husband beat her at home. And then I understood that I must ensure patient's dignity and privacy. So therefore, I listened actively to the patient. I documented verbatim words of the patient, and I ensured that I followed the hospital safeguarding policy. I escalated to the nurse in charge and the safeguarding lead of my hospital, and I also ensured that the situation was escalated to the to the independent domestic violence advocates and the social services, and I ensured that I did all this without the knowledge of the husband. And when the patient was being transferred from my ward, I ensured that the patient's dignity and safety prioritizes discharge, and the the patient was preserved, and the patient thanked me, and she said a verbatim statement saying it was the first time that she felt heard without any judgment. So that was the time that I shot regarding. Thank you.
That's amazing. Well done. Even myself, I'm smiling. Well done. That's a good answer to that question. You've done well. So, can I have? Let's have a look. Who do I have? Victorious. Victorious.
Yes,
Do you think he did well?
yes,
And
he,
but do you think he would have done better in any other? Or do you think you want to add anything for him?
yes, I think he did well. And there's not too much I would like to add to what he has said, but he did very well.
All
Yeah.
right. So
Especially
carry
mentioning
on.
different categories of people he escalated to. I think he
But
did well.
don't forget, you need to document though. I did hear you said he documented verbatim.
Yes, he said
Yeah.
he does.
Okay, that's fine. Is there anybody that wants to add anything to what he has said? Anything different? Okay, that's fine. Oh, is there somebody?
Yes. Sorry,
Okay.
ma, this is Adeleke.
Yes,
I'm
carry
so
on then.
sorry. I'm in the ward at the moment, so I was busy with the patient. That was why I couldn't talk the other time. So
It's okay.
I want to contribute to what my colleague has said about safeguarding. I
Okay.
feel like he has done well. And let me appreciate him first. So what I feel he would have done that he was supposed to have given preamble before using the star approach to give the scenario sample, like probably define what safeguarding is in a very short approach, and also talking about the steps we have. Like, okay, we are going to recognize you, like you are able to recognize and you report and you refer and all those things. Sorry, I can't really arrange it now, but I know that I think the 5 hours of safeguarding is like five. So before you now go into what the scenario is all about.
Okay, thank you so much, Adeleke, for that. But he does not necessarily need to define, because the question is, can you tell me a scenario when you have done it? So they're expecting you to give them a scenario. So if you want to say, oh, safeguarding is about defend and protecting people who are vulnerable, it's fine. You can add that, but it does not really add to your mark. But you can add that as a start. That's beautiful. It at least sets a base. You understand? There was a scenario that happened in my this and that. It's still fine. But if he wants to go through that, say, oh, okay, thank you very much for that. So there was this situation, it's still okay, because they've asked him a direct question, like, tell me a scenario, what happened, what you did, and how you handled it. So it was actually a direct question. So he does not necessarily need to add a preamble. If he wants to, it's fine, but he does not necessarily need to add one. But thank you very much for that. That's a very insightful contribution. Thank you.
All right, ma. Yeah.
Thank you.
Thank you.
Then I want to go back to Victorious before I come back to Adeleke then.
Okay.
So can you tell me what is escalation?
Yeah, escalation is like maybe like, for
Wait,
an
I didn't
example.
finish my question. What is escalation? What are
Escalation.
situations that needs to be escalated?
Yeah.
Yes, let's go on.
Okay. Escalation is reporting incidents, or reporting something that is unusual. Like, yeah. So for an example, you can escalate patient care. Maybe you discover a patient is being abused by a colleague, or even maybe being abused by fellow patients, or maybe a patient is not well taken care of, maybe like in form of neglect, and then you can escalate maybe when the patient's condition is deteriorating or there are changes in patient's condition. You can also escalate when maybe colleagues and junior staffs, maybe when they are doing something that is not appropriate. Yeah, so you can escalate to the senior in charge, to the maybe a safeguarding department of the organization. Yeah.
Thank you very much for that. Thank you. So
You're welcome.
Adeleke, back to you. Can you tell me a situation when you had to escalate something? What did you do and what was the result at the end? Unless you've gone back to your
All
question.
right.
All right, go on, carry on.
Thank you very much for the question, and thank you for the opportunity to be interviewed today. As a nurse with extensive years of working experience, I've always worked in high working pressure area, which has made me to be exposed to so many escalations that has happened while on my duty. I remember a scenario of what happened while I was on duty on a very busy shift in 2 weeks ago. There was a patient that was brought into the unit with an account of breathlessness, and my responsibility was to ensure the patient's safety. Immediately I received the patient, I used my clinical judgment to check the patient's vital observation using the ACE approach according to the National Electricity Policy Guidelines, and I documented effectively into the useful chart. And I didn't hesitate to escalate to the multidisciplinary team for further expertise management. While still waiting for the multidisciplinary team to come around, I continuously assess the patient, and I also noticed that the patient oxygen saturation level has reduced to below 92%, which I immediately initiated the oxygen therapy according to the policy of my organization during emergency. I also ensured that the patient was comfortable. I kept on reassuring the patient alongside. Then I also noticed that the patient's blood pressure had reduced to 90 over 40 meters of mercury. I elevated him foot of the bed to ensure proper venous circulation. And also, I give 2.9% normal saline according to the policy to increase the patient's blood pressure. I still continuously monitor the patient's vital observation while still waiting for other multiplicity to come around. As a result of this, patient's condition stabilized and the multiplicity reviewed the patient and he was prescribed on medication to improve his condition. As a result of this, I've said that. Okay, so this experience taught me on being paying attention to every details of every patient.
Okay, thank you very much for that. I think I heard where like in between only because there was lots of background noise from your side. But I understand you said you were at work, so it's fine. So escalation.
And
So thank you so much. So escalation can come in different ways, okay? So escalation could be like what one of us have said. You notice something that is different from the normal or something that just arose, an incident, right? Escalation could be a patient has fallen on the floor, and what did you do? How did you escalate it? Escalation could be that, for example, you notice somebody just made a medication error. What did you do? How did you escalate the process? What was your action? You understand? How did you inform the senior team? How did you manage the situation? You understand? How did you escalate it to senior authority? Just like also the guy that spoke about safeguarding. What was your action? What did you do after? To make sure that things are back to normal, to make sure that things, learning incidents or learning opportunity are being done and people learn from the previous thing that happened before. Yes, so these are all about escalations, right? So while that's been done, thank you so much. Although I couldn't hear you, but I did hear you talk about one of your patients that was sick and how you escalated to the doctors and how you ensured you did continuous monitoring. You still have to ensure that you document what has happened, you understand, and make sure that the patient is safe, inform the family relative if the patient wants you to, make sure the patient is aware and comfortable of every situation that is happening with them, monitor closely, you understand, with the patient, and make sure you do a proper handover to the next nurse to make sure the patient is covered for the rest of the shift. And also inform the nurse in charge, who will also support by keeping an eye because she's the one in charge of the shift. Okay, so those are parts of escalation. So thank you very much for that. You've done well. So I have Kemi on the call there. Kemi, are you here? Can you unmute your mic if you're here? If Is Kemi here? If she's not answering, can I have Dorcas? Dorcas. Okay. Can I have Dorothy then? Be quick, 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 quick. Okay. If I also remove some people if they are not here with us. Can I have Promise? Why do I feel like I know this name? Can I have Promise?
Good evening.
Good evening. I don't know. I feel like I know your name, but probably is your surname. All right. Thank you so much. So could you tell me what is sepsis and a situation whereby you have you noted sepsis immediately? So what was the presentation like and what did you do? Thank you. Hello, Promise, are you here?
Sorry, I didn't unmuted myself, but good evening.
Okay, sorry.
Yeah, thank you
So
for
carry on.
this. Yeah, thank you for the section. So sepsis an is an emergency that I will need to act in a space of 1 hour to intervene um to be able to stabilize the patient without the patient being sent to the ICU. So with that being said, So when a patient presents, a patient that presents with sepsis would have some of these signs. That is when I'm going to rule out that the patient have a sepsis. The blood pressure would be low. The pulse will be high, maybe like a rate of pulse will be up to 112. The respiration could be 26, and then the blood pressure. Okay, and the temperature will be maybe 39.1 Celsius. So with these vital signs showing that the patient is presented with sepsis, I need to act fast because it's an emergency, as I said, and I'm going to be using the six. There's a steps for me to. There's a steps I need to follow to act right, and it's called the six. Is it the six? I've forgotten what they call it. So I'm going to first of all go ahead to have checked. I'm going to quickly check. Okay, there was a scenario you said I should put it in the form of it. So there was a scenario where there was an example. There is an example that stood out for me. It was one of the shifts. I had a COPD patient who was initially stable, but on going round for my observation around 2 a.m., I noted the change in vitals, and on checking the vitals, I noted the high using the News 2 charts. I noted the readings were high. So I quickly escalated. I escalated to the multidisciplinary team using the X bar, S being the situation, B being the background, A being the action and recommendation. I went ahead to commence high flowing oxygen. On doing that, I went ahead to also position the patient to make sure the patient is being placed in an upright position. On doing this, I also went ahead to set to cannulate the patient and obtain sample. So obtaining sample is to rule out the level of the lactates, to be able to, because what I initially used to know what was wrong with the patient is based on the vitals, but it needed to be ruled out. So I obtained sample and it was sent to the lab to check the lactate level as well. And then I went ahead to commence. By then, the doctor has reviewed and went ahead to prescribe some antibiotics, which I also commenced. And he also prescribed fluid to correct the blood pressure, to be able to stabilize, to correct the blood, to elevate the reason for that's it, supposed to correct the blood pressure. And I also went ahead to, if the patient was not initially catheterized, I did that so I could obtain keep note of the fluid, output, input and output charts, to be able to ensure that all organs are stable as well. So I also went ahead to monitor the patient's vitals, and then the patient was being stabilized, and after that I ensured to during handover to point out, I ensure to hand over using the X bar as well for continuous monitoring. I mentioned it. Thank you.
All right. Thank you very much. Thank you. Thank you. So all you just need to do is to calm down, okay, and just use the STAR technique to answer. So the situation that happened, the task, what action you did, and what was the result or the recommendation at the end of the day. So sepsis involves they have the sepsis six. There are different means of management. You have the buffalo. That's the easiest way to use to remember to say, okay, have I covered the basics and all of that. So before I give you an answer, or I might not, someone else might do. Can someone unmute to tell me what she did well, what she needs to improve, and give me your own situation, what you would have done?
All right. So she did well actually. She did well. She gave a good example. But then I'll just mention like some things that she could have mentioned so as to maybe score more points if possible. I think one of the signs of sepsis is the high temperature. High temperature. I think it is very important to mention high temperature while giving a scenario because it is one of the major signs of sepsis. And when when she mentioned SBAR, she said she would hand over using SBAR. When she mentioned SBAR, she was saying the full meaning of each word. Then when she mentioned A, she said A is action. Like I just want to make the correction that A is assessment. I think it is
Yeah,
assessment. So
is
like
as
not, yeah, so like it's
Doctor, I
not
made
action.
mistakes as
Yeah. Then okay. And also, and I just want to say this one like in an interview, instead of mentioning sepsis, instead of saying should give a scenario of sepsis, they can say okay, if a patient has a news 2 score of 8, like what would you do? And I think in the NHS and whenever a patient has a news 2 score of 8, it is usually sepsis. I just want to mention that like in case the question comes in a different way, like if the interviewer asks that okay, if a patient has a news 2 score of is what would you do? Like a news 2 score is usually indicates sepsis. So that's what me I just want to say.
okay. All right. Thank you very much for that. So they could come in different ways. They could say, okay, you took over a shift. The patient is having has not passed urine for that long. The patient has a catheter in, but it's not past urine, right? The patient is having a high temperature. The person urine is stinky, the one that he's passed. And the patient is looking agitated. The patient is looking confused. The patient is like, are you different situations? Blood pressure is low, respiratory rate is high. What would you do? Okay. Those are signs of sepsis. They'll say, oh, have a new score of 8, have a new score of 10, have a new score of 6 of 7. What would you do? So usually first, obviously, it's a situation. They could tell you to tell them a situation where you have to manage sepsis. So you have to talk about the situation, the task, the action, and the recommendation. You've done well, you've done a detailed response, right? So I don't want to go back. But management of sepsis is straightforward, okay? We are doing the um BUFALO. So that's oxygen, lactates, what are they calling it? Antibiotics, analgesia if possible, fluid management, the urine, bloods. Okay. So those are the basics. If you can cover all of that, you understand. So that will be able to guide you. So you just have to look more into sepsis. It's not like so much. Many of us have managed sepsis all the time as nurses. That's one of the most common things that happen most of the time. You understand? Sepsis could be so that you need to make sure that you act immediately so the patient will not go into septic shock. You understand? And that will be a much more higher situation. So escalating it to the doctors or to the med team if you're in the NHS, you know what the med team is, and they will carry out action, do check the blood pressure and all of that, keep on continuous monitoring, put up the fluids, IV fluids, antibiotics prescribed, keep a close eye on the fluid management, the fluid balance, and all of that. Yeah, take some bloods to send for the patient. You understand? Money to do the doctors might want to do some blood gas or VBG or all of that. Put the patient on oxygen if the SATs are low. So these are the things, and then keep continuous monitoring and handover, like you said, to make sure that the staff taking over your shifts keep a close eye on the patient, mentioning what has happened and all of that. So those are basic things for sepsis. So thank you so much. You've all done well. And then
Sorry, excuse me.
just give me a second. In a situation where they tell you that you have to tell me how you manage a patient and all of that, the R you should always talk about the patient that you've managed and what happened at the end. You understand how the patient recover, the patient deteriorates. Obviously, you have to see the patient recover at the end of the day. Now, you not see the patient deteriorate. So, yeah, those sort of things that will help you. So, carry on with your question.
Not a question. I wanted to add something concerning what the other guy said just now. He
Okay.
mentioned news to score of 8 being sepsis. I
Okay.
wanted to say it does not really mean if they say a person has a news to score of 8, it does not really mean the person has sepsis. It just means it could be sepsis, but
It could be
the
sepsis.
patient can also be deteriorating in other ways, not generally that it is sepsis once the NIS2 score is 8.
Yeah, that's also something to mention. Yeah. So it could be sepsis. It does not mean it is sepsis because they need to do an assessment of the patient, right? There are different reasons why patient will have news to score of it. Might not be sepsis, okay? But it could be. So based on the symptom that the patient is presenting, obviously you have to act on it because if it's sepsis, you want to prevent that as soon as possible. After your assessment, based on your findings, you still have to escalate to the doctors, escalate to the med team, escalate to the nurse in charge. You still have to do so many things, especially based on what you have seen and all of that. So yeah, it's part of it. So thank you very much for that addition. Thank you. So now, next, who is the person that spoke? Who spoke just now? The last person. Love Star has spoken before. Who is the last person that spoke?
It was me, Osasume.
Okay, so you spoke before, but it's still okay. I'm doing another round because other people are running away. So, what is patient-centered care?
Patient-centered care.
And yeah,
Um,
and that's a simple question. So, I'll add a second question to your question. So, can you tell me a time where you have rendered a patient-centered care?
no, okay. Patient-centered care just has to do with it's just personalized care, making sure the care you are giving to a particular patient is focused on what that patient is, on the condition that that patient has, or the condition that the patient is going through. I can remember a time when I was still working at Edo Specialist Hospital. We had a patient who was brought in after surgery. So the patient needed more attention because of the pain the patient was feeling. So what I did, I tried to incorporate both pharmaceutical and non-pharmaceutical measures in caring for that patient, which included teaching the patient diversional therapy, giving the patient pain analgesics, helping the patient to, or encouraging the patient to be ambulant so as to help the patient recover fast. I made sure my full attention was on the patient. And after that, the patient, within 4 days of care, the patient was up and about, was feeling good, feeling fine. Uh, so yeah, and I made sure everything was documented as it went by. Every details were documented.
Okay. All right then. Thank you very much for that. That patient-centered care is basically just giving care based on the patient's needs, right? So you have to understand that each patient is different. So you have to note what the patient wants and how can you render the care based on the patient's needs, right? So for example, you want to give a patient or you're trying to offer meal to a patient, it's not what this patient wants as a meal that the patient B will want as a meal as well too. Patient A could be prescribed Oramorph and codeine. Patient B could prescribe Oramorph and codeine. But patient A will tell you, when I take codeine, I get constipated. I can't take it. Please, can you give me oral morphine? And then patient B could say, oh, I prefer oral morphine compared to codeine. You understand? So, or I prefer codeine compared to oral morphine. So these are different. So you have to know what does that patient want, or whereby patient is being you are working with the doctor on the ward rounds, and then the doctor just tell the patient, oh, okay, you have cancer, just like that. No privacy, no dignity maintained, nothing like that. The patient just burst out in tears. As a nurse, what's your action at that point? Okay, you should be, once the doctor step out, you should be telling off the doctor for what he has done, and then you should go back to the patient and stay with the patient for some time, offering care, asking how can we support you best. Do you have a family you want us to ring to come and be with you at this point? Would you like? Do you want to offer with a cup of tea? Do you want anything we want us to offer you? After that, you should go back and be reporting the doctors to the senior nurses, documenting that and putting in details because that was hampering of the patient's dignity and all of that. So these are things about knowing what the patient wants. Well, how best can you communicate to a patient? Another scenario is a patient, you receive a handover from different situation whereby you receive a handover from different people and they tell you that, oh, this patient is being difficult, but then you go to you approach the patient and then you understood that, oh, the patient was not being difficult actually. It's just that the patient is having difficulty in expressing itself because the patient doesn't speak English effectively, but the patient knows how to under wants to be able to, and patient also feels that because he doesn't speak English, he's not understanding what they are saying. And so when he's trying to communicate back, he's struggling, and people are thinking that he's being difficult, but he's not fully grasping. So what can you do? You can involve the get what they calling it, a translator who can support in translating. You understand? Or maybe the patient is trying to communicate. Is a patient that has learning needs, maybe have autism, have ADHD, and they cannot communicate effectively. Some of them they prefer to write to communicate rather than talk. Some of them that are having this learning disability, and because you took your time to understand this patient's particular specification, you're able to communicate effectively, and then you hand it over to the next team that, oh, this is how the patient communicates. The patient prefers to write when communicating, and ever since then the patient was happy, every staff was happy because the communication was now better and the hindrance that was happening that made the patient seems difficult is now being overcome. So these are situations that happen. So these are different, though yours is also good. I'm just giving other scenarios for those that are cracking their brains to think about patient-centered care. This is what we do every day and we do every time as nurses. So thank you so much for that. And then can I have who will I call now? There's a name I'm seeing here that says favor, but it starts with a Phayvvor. Are you here? Is that person here? Is that person here? Okay. Since that person is not here, let me go back then from the beginning. Do I have Kemi here now? Do I have Kemi? Do I have Dorothy?
Yes, Kemi is here.
Oh, Favor is here. Kemi is here. Okay, don't worry. Let's have Kemi for now. So,
Okay.
Kemi, what role are you applying for?
The community role.
Okay, so can you tell me what you understand, right? What do you understand as that role? What's the role of is that a band 5 role?
Yes, it's a band 5
So what's
role.
the role of a band 5 community staff now? What do you understand by their day-to-day activity? What do you do?
Okay, so from my gathering, I understand it's me giving services to patients at the comfort of their home, to limit admissions to the hospital, and or maybe readmission, palliative care, assessing them, like checking routinely their vital signs, their glucose level, wound dressing, and if they're on oxygen therapy too. That's my understanding of the community role.
So what difference will you say the community role is to those in the private in the hospital, like the acute setting?
Okay, so the difference is, at least in the hospital now, everybody is present, including the GP, the doctors, the nurses, and other practitioners. Unlike you being a community nurse, the community nurse makes decision like on her own um without the influence of the doctor. So she's able to carry out activities unsupervised. Unlike the hospital now, where we have all different settings, if anything should go wrong, she's able to refer, or he's able to refer to the doctor. I don't know if I'm getting it right. Sorry, this is my first time here.
No, it's okay, it's fine. So you do have a point in the for a community nursing role. A community role, they are closer to the patients in their home, than those in the acute setting. So for a day-to-day activity of a community nurse, it involves, like you said, wound dressing, assessing of patients, it involves referral, palliative care, you understand. And most of the time community nurses, they act independently as compared to in the acute setting, whereby you have there's more of a team work, whereby although community work with team, but it's not as in the hospital they are all together in there. But most of the time the community nurses, when they go out to do this thing, they're working independently. But if they note something is wrong, they are doing referrals to or they are calling the emergency team to come to the patient's home, or those that do a walking center to the community, they are doing referral to the GP, you understand, or referral to the emergency department, you understand, to take it up from there. But a community nursing role obviously involves they are closer to the patient, they are able to see this patient in their own environment, in their own residents, you understand, and so they're easy to give care directly to them at home rather than in the acute setting. So those are different, and those also cover the basis of what community nurses do. So that's fine. You might not have touched everything, but you've covered some of the basis of community nursing. But you do need to go back and read more on the rules of the community nurse, okay?
Thank you very much,
And
Angela.
then not only that, you also need to create a structure to give your answer so that it's not left empty. You understand? So that they won't be like, oh, okay. You say what if they ask sometimes they ask you what do you understand as the role of a community nurse? You can give some example related to your own experience so that they feel like you've done it as well too. You understand? So that's another tip bonus. They might not tell you directly, but it's always good to somehow give, even if it's one example of one of the role that they do. You understand? And relate it to yourself and how you also do it. So that's just a tip bonus, okay? So I
Thank you
have
very much.
who was the person that I want to talk to before?
Favor with the
Favor.
P.
Favor, are you here?
Yes,
Okay, so what role are you applying for?
I think it's geriatric, but they wrote generic on the job description.
Okay, so what do you know about the day-to-day activity of that role? What do you know about the role that you're applying for?
Okay, the day-to-day activity of a geriatric nurse will include communicating with the elderly patients in communicating with the elderly patient and making sure that they understand the care that you are providing for them, ensuring that you carry them along in making decisions about their care, and um identifying any challenging behavior, and being able to recognize any deterioration in their care.
Okay, let me give you an answer. So,
Okay.
day-to-day activity of a geriatric nurse. So, can you tell me what the day-to-day activity of a geriatric? Oh, thank you so much for that. So, geriatric patients are usually the elderly patients. So, as a nurse, and if I'm working in geriatric unit, the first thing I'm going to do is I'll take a detailed handover from the nurse that is going to be that did the previous shift. After which I'm going to assess my patients, because we have different geriatric patients. Are some of them are at risk of fall, some of them usually get like dementia, some of them are confused due to maybe that's their baseline, or some of them have what are they calling it? Some of them, because they have frequent urinary infection, they could get new confusions and all of that. So when I go to see my patient, I'll make sure I'm doing a thorough assessment of them and also checking their vitals. Then next also I'll be giving them their medication, because some of them are used to have some time critical medications, because some of them could be having Parkinson meds, for example, and these are medications that are time critical. You must give them at a certain time. Also, geriatric patients, some of them also have are diabetes. So after giving medication, I make sure I'm checking their BM, especially that's their blood sugar, prior to feed and in between feeds as well too. taking the fasting and the random blood sugar to keep a close eye on them. I also have to make sure that they are well supported because they are high falls risks. So I'll make sure that they have their equipment to support them around in terms of mobility, and those that cannot mobilize as well too. I have to make sure that there are support measures around to make sure they are safe. For geriatric patients, these people are quite old, their skin could get really bad. So I have to make sure that pressure ulcer preventive plan is put in place for my patient. I also have to make sure that I involve my family and the patient's family, because geriatric patients are very vulnerable patients. Their family will always be concerned about them and want to know so much about their progress. Some of them might not also be able to understand what the doctor is saying during the handover. So I'll make sure that I understand the plan of the day and communicate it to the family or the next of kin, so that they can easily communicate with each other. They are well aware of everything. Overall, the day-to-day activity of a geriatric nurse involves making sure that the elderly patient are ahead of, they are being taken care of, their obs are being done, BM is being done, handover is being done, they are safe and protected, right? And all those other things are done for them. So these are day-to-day activities. So it's not just about saying they are being careful. That you need to go into details to talk about things that are being done. And these are things that they do as in for nurses generally. But if you don't go in depth, they'll feel like you do not understand, because geriatric patients is different from a urology patient. For geriatric patients, they have issues with confusion, they have issue with infection, especially with urine, they have issue with low BM, blood sugar monitoring, they have issue with falling down most of the time, they have issue with pressure ulcer. So you need to mention all these bits around your geriatric patients. Do you understand?
Yes, thank you.
All right, thank you so much. So when they ask you, make sure you have a plan on. I remember there was a certain time I was going for a band six role as a ward sister, and then one of the questions they asked me is, "Can you tell me what the day-to-day activity of a ward sister is?" You understand? I will not just say the word sister just take over the word, right? What I had to do, I had to start going straight, right from the handover, how you talk about in the huddle, going straight to how you work with the have a board round with the team, everything in details, like as if I'm the one doing it step by step for everything they do in detail. And then you could see the interviewer, they were seeking, because that's what they're expecting you to say. They want to see in depth. They don't want to see a generic response. They want to see in depth of what the person is doing. Hope you get.
Yes, I do. Thank you.
All right, thank you. So I asked on the group that who is you should give me a list of where you're working, and some of you say you are having interview for emergency department. So if you know that you're having interview for emergency department, can you say unmute your mic?
Yes.
Okay, so Jane, you're having interview. Okay, so this question is for you. Okay, so you are in the emergency department. A patient suddenly become breathless. What would you do?
Okay, thank you for this question. When I notice that a patient becomes breathless, I remain focused. I assess the patient using A to E assessment. That is airway, breathing, circulation, disability, and the exposure. I calculate the new stool. After calculating the new stool, I escalate concerns. I will stay with the patient. I will continuously monitor the patient's vital signs and document. I will notify the consultants and the team about the concern of the patient. I will show empathy and sympathy. I will sit with the patient, holding the patient's hands, holding the patient and reassuring the patient. I will commence oxygen. I will also set cannula. I'll put up cannula, commence oxygen. Then if there is any prescribed medications, I will prescribe the medication. I keep on reassuring the patient. I document effectively and on time. I will make sure that patients receive the appropriate care needed for the patient. Then I'll keep on assuring the patient, telling patient that you are not alone, we are here with you until when the patient is stable. Thank you.
Thank you so much. So what if you put up oxygen for the patient? You've done your assessment, patient oxygen is low. You put up oxygen for that patient, but the patient oxygen level keeps dropping. It's the patient now is having oxygen of 60, right? The doctor has not yet arrived, but you put out a call to the doctors and it's not arrived. What will you do?
Okay, I will check CPR. I will start CPR for the patient because I know the patient is deteriorating more and more. I will start up
But you cannot start
pulmonary.
CPR for a patient that has a pulse.
Okay.
Patient
I
is
will
still
increase the oxygen. I will set up IV fluid. Then I will increase the level of the oxygen. I will escalate to the water and the team.
okay. That's fine. You've done well. You've done well. You've actually answered most of the important questions, which involve the ABCD assessment, the oxygen, the escalation, and the new score brilliantly. Those were the key factors. I just had to push you a little bit. So if a patient new score keeps dropping, you understand. Obviously, you have to increase the oxygen, right? And you will get maybe the patient was on nasal cannula. You will now put the patient on the one that do you know what a reservoir max is? I don't know if they use it in Nigeria. A reservoir max. So it's like
Yes.
exactly. So you can put up a reservoir max for the patient if the oxygen is still dropping, and if it's still dropping, you can call the emergency. You can pull out the emergency and call for the emergency team to come for support and also inform the nurse in charge. I don't think Nigeria have emergency team. You understand? But in the UK, they have
Yes.
emergency team. So you can just say, currently in my trust, if it still drop in my hospital where I work, if the oxygen is still dropping, I'll put up the reservoir max. If the oxygen is still dropping, I will quickly inform the nurse in charge to get the senior team to come quickly and review. I also make sure that I work in line with the hospital policy. You understand?
Okay.
With the hospital
Yes.
policy. Because if you start cramming UK owner, you might not be able to know what to say. Because UK own, they have a med team. It's an emergency team that comes quickly down to come and give a hand.
Okay.
So that's what it is. So
Okay.
well done. You've done well for that. Okay. So is
Thank you.
there someone in the surgical area who is having surgical interview?
Yes, I am.
Who is that?
Lobster.
Okay, all right, thank you.
I am
So,
also. Yeah, I have surgical.
all right, that's fine. Okay. So you have a post-op patient that comes to your ward, right? You do the obs of the patient, and the patient is suddenly hypotensive. What do you do?
Thank you very much for that question. I sorry, please. Okay. Um, I understand that if a patient is hypotensive, I understand that it is an early sign of deterioration. So therefore, I will ensure that I remain calm and composed and organized, and I will I would ensure that I escalate immediately to the anesthetist, and I will conduct full assessments on the patient using the ABCD approach. I will also assess the patient's vital signs, including the temperature, pulse rate, respiratory rate, the oxygen saturation, and the blood pressure. And I would ensure that I start oxygen therapy if needed. If needed, I will ensure that I start oxygen therapy, and I will also obtain an ECG if necessary, and I will ensure that I continue to reassure and to provide the assurance and emotional support to the patient while the anesthetists arrive to review the patient. And furthermore, like, I will ensure that that emergency equipment and emergency medication are made available, and I will also assess the surgical sites for any signs of bleeding
So waiting for the
or
patient.
infection, and
So
Ma?
Go on, go on.
Okay, and I will also ensure that the IV access is patent in case of any urgent intervention, and I would ensure that I continue to monitor the patient following the NISU policy. I will also ensure accurate documentation, and I will ensure that that I communicate the patient's condition clearly to other team members to ensure continuity of care. Thank you.
Okay, thank you so much. You've covered most of the bases. You spoke a lot, and then I was waiting. Did you know assess the surgical side? What if the patient is bleeding? What if that's why the patient is hypotensive? What if the blood volume is dropping for patient bleeding somewhere? You understand? So I was waiting for you to mention that surgical side, which is very, very key, and then you mentioned it along the line as well too. So thank you so much for that. That's good. You've done well. To me, that's a good answer. Does the second person have anything to add? Sorry, I did not catch your name when you said something. I only caught the first person's name. The other second person that's having surgical interview.
I'm the one I'm the
Just
second person. Yeah,
yeah. Do you have any other thing to add, or you do the same thing?
yeah, he covered most of the basics and he was very detailed about that. So that's a good answer for me.
Okay, that's fine. So how do you prepare a patient post-operatively then? A patient is going for theatre. How will you prep the patient pre-operatively, sorry?
Okay, operatively. Okay, first of all, I'll ensure that the patient, the WHO safety checklist has been undergone, like there's consent form. The patient is out has all the knowledge concerning the procedure and has signed consent for this procedure. I'll ensure that he has the two identity wristbands, one on his leg and one on the hand on opposite sides. I'll ensure that all the necessary lab results, lab investigation has been carried out and the results are out. I'll ensure measurement has been making for test stockings and the incision site has also been marked for the surgery and for the surgery, and measurement has been taken for his test stockings. So I will communicate with the patient concerning the surgery, answering any questions the patient may need, and also making referrals if I need to refer to the surgeon and to the operating team. So I think that's what I would do to prepare a patient pre-operatively for surgery. And
Okay.
I forgot new part oral if it's something that requires new part oral, and the type of anesthetics that will be used for the surgery. Thank you.
Okay. Have you asked the patient if the patient know about the surgery and has he signed the consent form about the
Yeah,
surgery?
I started with consent. I started with explaining the procedure and letting the patient know
If they
what
don't
is.
necessarily, I don't think it's you don't necessarily, nurses don't actually explain the procedure because you will not know what's going to happen inside. You're not the one doing the surgery. But you have to make sure ask the patient. You have to understand that ask the patient. Have the patient know the surgery he wants to have? Does the patient understand the surgery he wants to have? The patient know the risks and everything as the patient sign the consent form. So you are trying to understand that the patient understand what the surgery he wants to have. Someone has spoken to him, he understands the risks and he has signed it. So that's what you are confirming. But you're not the one going to explain the procedure because obviously you're not the one going in there to do that surgery. That's the difference. Do you understand?
Okay. Yeah.
Yeah.
But I talked about the signing the consent form too.
Yeah. It's okay. That's fine. I think who was the first person that spoke? Is it Love Star that spoke for this surgical?
Yes,
Do you
yes.
have any other thing you want to add?
Yeah, she has mentioned most of the things, and even to that, I would just add that okay, I would conduct a comprehensive pre-assessment, pre-operative assessment on the patients. I will collaborate with other team members to assess the patient medical, surgical, and anesthetic records, and I will also assess the patient's lab results, the fasting sectors. I think she mentioned the medication, the patient allergies, and I also ensured that all proper documentation have been completed, and I also ensured that the patient's preoperative assessments meets the WHO requirements. So those are just the things I would add.
All right, thank you very much for that. So, can we have someone that's in the community that's having community interview, or mute your mic and speak? Community nurse interview.
I also have community
Is
too.
this
So
you? Is there any
I
other
have
person?
community on Monday, surgery on Tuesday. So
Lord is your strength. Okay, so your patient, you go for a home visit and you notice your patient deteriorates. What will you do?
okay, thank you very much for that question. I go for a home visit and see my patient deteriorating. First of all, I will assess my patient using the ABCD method. Then I will depending on how responsive my patient, if my patient is responsive, I will take as much history as possible, asking essential question: what happened, what happened when he felt a difference. After that, I'm going to immediately escalate and call for backup or help, or for the ambulance. I will give them all the necessary details, my assessment, my vitals, the history I was able to gather from my patient. Then meanwhile, I will provide support to the patient, maybe positioning if it's something I need to position my patient in a better manner. I'll continue to assess and monitor the vital signs, communicating with the team that is coming to ensure that I update them on any changes, and I will. And if there is any plan of care that they want me to execute, execute I will execute them. So sorry, I will execute them, and I will ensure that my patient doesn't lose consciousness. I can keep my patient engaged by maybe still trying to make sure that they are responsive, talk to them, to try to distract them while I'm awaiting help. Thank you.
All right. So when you go to a patient, okay, and you notice that the patient is deteriorating, the first thing you do is to escalate. Sorry, the first thing you do is to assess the patient, obviously, yeah, using your tools for assessment, but also the ABC and also the community tools, right? After doing that, if you note anything is wrong with the patient, maybe you feel like, is it urine infection? Is it like the patient, like for any reason, right, that you've noted, is it low blood sugar? You know that one, you can easily act on it, yeah. But if it's something that needs escalation, you escalate it to either the GP, depends on how urgent it is. So if it's something that needs immediate attention, you'll be calling the emergency team. You understand? To come into the patient's home to take the patient to hospital. But if it's something that probably it's something that you've treated already and it's not urgent, you can refer to the GP for the GP to come straight in, you understand, and then work on that, you understand. And after that, you make sure that if something that require emergency, you're making sure that you are continuously observing the patient while you are waiting for the emergency team to come. While you are doing that, you're still with the patient, reassuring the family as well, and communicating with them, because if the person lives with the family will be worried and concerned about what's going on. Now, once everything is done, you're doing what you've done, emergency has come. If it's something that require emergency, you make sure that you've done a full documentation and do a referral, and also make sure that you've put a plan for follow-up where you can follow up the patient. You understand? But if something that maybe low blood sugar and all of that is something that you can treat immediately. After doing that, you document, make sure that you put up a plan for follow-up to make sure that you're keeping a close eye, and also do a referral to the GP to also keep a close eye on the patient BMO if there needs to be any medication adjustments to do that. You understand? All right. So you've done well. You've done well. You've done well. Okay. So is somebody here? And I saw occupational health nurse or occupational health role. Who's that?
I'm the one.
Okay. All right. Thank you so much. So a staff member says they are stressed and want time off, and you've been called obviously to the they come to meet you, occupational health, yeah, nurse. So what do you do?
Uh, the very first thing to do is to take vitals for the patient. That's assess the patient. Then make the take history. Ask the patient questions. What's how the patient is feeling? What the patient is feeling? Sorry, should I say patient now or nurse? Well, it's a patient now. How the patient is feeling, what they are feeling, what's what part of their body they are feeling, what they are feeling, what kind of stress they are having, if it's mental stress, physical stress, because as a nurse, there can be various type of stress, whether it's burnout, whether they are feeling stress due to the place they are working in. So after getting all this history, depending on the kind of stress the patient has voiced out on, I can make my assessment. Oh, sorry, I can make my diagnosis. After that, I would have to call the patient's manager to um, to let them know what the result is. It could let's say the patient is having stress from let's say the patient is having mental stress due to burnout because of low or because of being short-staffed at work. So the patient is very stressed, maybe having pains, back pain from standing too long, or just stress in general, burnout. So I'll let the manager of the patient know that okay, this is the diagnosis or this is what I came up with after assessing the patient. So the manager, according to the trust policy, the manager should know what to help the patients with to help them relieve that stress. If it's to give them some time off work, or if they are to take, if they are to commence them on any medication to help them with the stress. So that's it.
Okay, so thank you so much for that. You've done well. Yeah. So first thing, like you said, you need to assess the patient. So take history to know what's going on. Is it work related? Is it family related? Or is it health related? Right. After you'll be able to deduce and know what has actually gone on, you'll be able to write put out plans of actions and also give a feedback back to the organize to the team obviously that referred, or if it's the company you are working for, if it's something that how can you support the patients or support the staff, not patient now, support the staff. Is it something that they are burnt out from work? Do they need to support in terms of extra staffing, or is it something that the patient will not be able to continuously do all those standing sort of work? Can they give the patients the why am I always saying patients, the staff some time off to have a little bit of rest before coming back to work? Can they drop the workload? You understand? Can they also put rather than doing a walk around work, can he do a desk work? You understand? If it's something that need life changes, you understand? Is it something that happened from their home? Do they need? Is it domestic violence kind of thing? Do they need support in any way? See where you can give local support to the patients. So that brings in referrals. So is it something that you also need referral to the GP? That's the general practitioner health practitioner. Maybe something that has to do with their health, and that's why they are stressed and they need time off. So you can do a referral to the GP, to the doctors, and also a follow up. You understand, so that they can look
Mm.
close into the person health and also document and give feedback to the organization for what's your verdict? Do they need to give them the time off because of this is what is wrong with them and all of that? So that covers everything in terms of occupational health and all of that for this question. You've touched some of it, just you didn't mention the referral as well. So that one is also important. Okay.
Okay, thank you.
All right. So is there any, I think I've covered the people that said their area, but is there anybody that's posted but I did not cover? Which area is that? Because some people have not spoken. Who did I not cover? Which department did I not cover? I covered community, I covered emergency, I covered yeah, and the rest of them I just covered it. So which person area have I not covered?
Mental health nursing,
Oh, I've not covered
particularly.
mental. Oh, I thought I did cover that one. Okay, that's
Mm-mm.
I didn't. Okay, so just give me a second and let me. Oh yeah, I have mental health notes that I kept down for you. Okay, so I have one that I kept for you. Let me see. All right, let me ask you. Why do you want to? I have two questions for you. Well, I'll start with the first one. So, why do you want to work in a forensic mental health area?
Okay, thank you for this question. I'm genuinely motivated to work within a mental health forensic setting because I am passionate about supporting individuals with mental health conditions and the history of offending to recover, develop coping strategies, and reintegrate safely into the community. My interest in forensic nursing developed during my placement in the prison mental health setting, where I observed how these patients are supported within a secure and structured environment. Currently, I work in the mental health unit, so I've developed strong skills in risk assessment and management, which is essential in this role as these patients have high risks and require safety. I regularly carry out ongoing and dynamic risk assessments by looking at patients' changes in mood, behavior, and identifying risks such as self-harm, suicide, aggression, or deterioration, and working with the multidisciplinary team to implement strategies to reduce their risks and ensure their safety. I'm also drawn to the rehabilitation and recovery focus of the ward, where where the focus is not on the patient's symptoms, but on working with them to to understand and manage their behaviors, and then develop strategies that would help them regain their independence, then step down to lower secure care and eventually discharged into the community. I find it very rewarding when patients that are at high risk, that are at high risk initially, reduce and reduce their risks, and they are able to um, live independently, carry out the activities of daily living, and live fulfilling, meaningful lives. The values of NHS Stayside also aligns how I practice as a mental health nurse. I I treat my patients with empathy and maintain their dignity at all times. I also value involving patients in their care, thereby tailoring the care I provide to them to meet their needs individually. I believe my skills, values, and experience will enable me contribute positively to the team.
Okay, thank you very much for that. You've covered a lot of why you've got um, interest in wanting to apply for the role, and I can see that is quite detailed. So, can you tell me, you have a patient, right, that you've cared for, and the patient tell you that once he's discharged, he's going to go and harm somebody, what are you going to do?
Okay, thank you for this question. If a patient prior to discharge informs me that they would harm someone when they are finally discharged, I will take their words seriously and prioritize their safety. The first thing I would do is to escalate. The first thing I would do is to work with the patients. That is what the first thing I would do is to work with the patients and then carry out a full risk assessment to explore there any intense plans or means to carry out them that thoughts. Then I would provide support to the patient, ensure the environment is safe, and also monitor them closely. Then I would escalate promptly to my ward manager and the multidisciplinary team so that the discharge can the patient can be reviewed and then maybe halt the discharge. Then I would continue to monitor the patients, review their progress, update their care plan till they are more stable to go. That is, they are no longer having that plans or thoughts to harm someone or themselves after they are discharged. Thank you. I don't know what else to say.
You've covered most of the bases. Another thing you need to add is you need to let the other staff member know, so as well so that they're aware to keep a close eye. Like let other staff,
Okay.
apart from your senior nurses and the
Yeah. Okay.
MDT, inform the other managing team, like the doctors and the rest. Also let the other staff so that they keep an eye. You also make sure that the patient is in a visible area, so the patient is not
Okay.
like, yeah, make sure that it's in a visible area. If probably it was in a bay before in a room, bringing him into the base, into the where staff can easily keep an eye on him. You understand? So that
Yeah.
they don't note any sign of anything that he's trying to act upon. You understand?
Okay.
So thank you so
Yes.
much. So somebody put that they are in HIV department. Can oh sorry, they are interviewing for HIV department. Can you unmute your mic? HIV department. You put that in the chat box. Who is that? Who put that in the chat box? Okay. I've seen you've unmuted your mic. Are you sure you can hear me? If you can hear me, please say something so that I want to be sure you're here. I can't hear you. Can anybody hear the person? Is it me? I can't hear you. Victorious, I can't hear you. Oh, you can hear me? Oh, really? But I can't hear you. Can any other person hear him? Can any other person hear him, or is it my network?
Nobody is speaking, no, except you. Like I can't hear any other person.
Okay, so Victorious, can you try and go out and come? Because I wanted to ask you a question, which says, how would you care for a patient newly diagnosed with HIV? So that was my question to you. All right. So while we're waiting for you, um, is there anybody that I haven't touched your topic? Is there but anybody I've not touched your topic? All right, that's fine. I know we've got up to like we've got a lot of people on this space. I just want to let you know that the truth is that we cannot cover everything yet because we say at 7 o'clock, it's almost 9 o'clock, so we spent almost 2 hours here, right? And I want you to just know that when you're going for an interview, you need to be confident. You understand? Just keep practicing. keep talking to somebody, or if you don't have anybody to talk to, keep saying it out, just talking the answer. Don't keep the answer in your head. Keep saying it out. Listen to yourself. The best person to assess you is yourself. You understand? And if you feel like you're not confident, you still want someone to have a look at you, can also meet AMGS for your support. I cannot hear you, Victorious. We can meet AMGS for support, because we have a one-to-one interview preparation where we prepare you for interview for just a token, right? So we can always be there to give you a hand and listen to you speak, and you have a private session just only you, while listening to you speak, giving you, asking you detailed questions that is tailored specifically to your environment. Remember, there are some little things that will definitely be asked regardless of which area you are in. Escalation, safeguarding, you understand. What are they calling it? Risk management. The person in geriatrics, you will know, you have falls, you have infection, you have pressure areas. Mental health, you need to know your mental health rules and regulation. You know how to identify when, if a patient is agitated, aggression, you understand. For those in the community, a patient with low blood sugar, patient is deteriorating, you get to how will you handle communication between family? Palliative cases in the UK is increasing, so you need to look into that. For those that are having occupational health, it's questions like staff are stressed, they don't want to work, and they want some time off, you understand, where there's an emergency that happened within the environment. How will you act upon an emergency in your workplace? You understand? These are things they will ask you. For those in the surgical, obviously, you know, pre, post, identifying infection, wound management, pre and post, and all of that. So you have to look into that as well too. So if there's any other thing I'm not covered, just know that most of the time it's always resolves around, it's a band 5 rule, and by 5 rule usually are always hands on deck of what goes on, and anything you don't remember, just try and remember little things that you've done and just use it to twist it to find an answer to give. So thank you so much for today's session. We'll be having another free session next month, and that's May, because we're already getting towards the end of April. I wish all of you success in your current interview, so that you don't need to have another interview unless you're going for a higher role or a better position. So thank you, and I wish you all the best. Bye bye for now.
Hi,
Thank
can you
you.
hear me now?
Oh, now we can hear you, but
Oh
we're
my
already all
goodness.
done.
Oh,
Right?
all right.
What you do, just do a voice note and send to the group. We'll correct you on the group, okay? All
Okay.
right, don't
Thank
forget
you.
that when you finish your interview, please, I beg you, please, could you put your questions on the group? And you don't need to put your name, it's fine, just your questions. So we can also use this to support. We have a Telegram group, I'm sure most of you are there, whereby we post questions there. We don't charge anybody for it because we get it free, so we post it there free. So we're not doing it to get any question for ourselves to make money, nothing like that. Everything is free. Freely we receive, freely we give back, okay? And also, it's also to support those that are coming. We have young nurses coming along the way. So thank you very much, and bye bye. Okay.